Assalamu alaikum. Today we will be talking about the dental waxes. Dental waxes have various applications in dentistry, the main being for the production of wax patterns, which we require to carry out before the construction of any restoration or prosthesis, especially in the indirect technique or when we are fabricating our prosthesis within the lab. So let's move on to the learning objectives. So, firstly, what are dental waxes? You should be able to name and classify the dental waxes according to their origin and uses. Now, the classification according to the uses or application is very important and commonly asked in your exam. You should be able to describe the properties particular to dental waxes such as the melting range, the solid-solid transition, thermal conductivity, flow, as well as the mechanical properties. Finally, the composition and clinical application of these three waxes is very important: base plate wax, casting wax, and inlay wax. Let's go to the definition of waxes. Waxes are basically defined as low melting, high molecular weight organic mixtures or compounds derived from natural or synthetic resources. Based on the origin, they may be classified as natural and synthetic. Natural may be mineral, plant, or animal based, and synthetic are obviously man-made or artificial. Based on the uses or application, as I mentioned before, this classification is very important, especially with respect to your SEQ exam. There are basically three types of waxes: pattern waxes, processing waxes, and impression waxes. Pattern waxes are composed of inlay wax, casting wax, and base plate wax. Processing waxes are composed of boxing and beading wax, utility wax, and sticky wax. And finally, the impression waxes are composed of the corrective waxes or the occlusal or bite registration waxes. We will be dealing with all these waxes individually. So let's start by going over the general composition of waxes. As I mentioned earlier, there may be of natural origin, synthetic origin, and additives may also be added. In the natural waxes, we have mineral and plant and insect waxes. Mineral are usually paraffin, ceresin, montan. Plant waxes are usually carnauba, candelilla, cocoa butter, and insect waxes are commonly basically beeswax. Then the synthetic wax include acrowax, aldovax, flexovax, and then there are certain additives that have been added to improve the properties such as gums, oils, rosins, lamar, shellac, etc. Now, what are the uses of waxes? In dentistry, they are important in the fabrication of wax patterns for various prostheses like dentures, crowns and bridges, inlays and onlays, metallic spins, and orthodontic appliances. Apart from that, they have other uses, for example, for making occlusal or bite rims and establishing the maxillomandibular relationship. This is a step that you will be carrying out when you do your denture making procedure of complete and partial denture. So basically we make occlusal rims or bite blocks, and onto that we articulate the artificial teeth, as you can see from the pictures, and that is done to basically establish the maxillomandibular relationship, which is the relationship between the upper and the lower jaw. Registration of occlusal bite relationship, checking the high points of articulation, and may be used to form part or portion of a tray, and also used to record impressions. So these are the various other uses of waxes apart from making wax patterns. Now, the ideal requirements of wax or dental wax are, first of all, it should be very accurate because it is actually being used to make prosthesis further on. So accuracy is of utmost importance. It should be dimensionally stable, because in case of the direct technique, when you are placing it in the oral cavity and removing it, there is a marked difference in the thermal in the temperature, and these thermal changes can lead to distortion. Should be able to soften at appropriate temperature and harden at the oral temperature. Should not leave any residue on burnout. Should have a good color contrast with the cast or model. It should have very good flow properties to record the details. It should not flake when we carve it, and it should be cohesive and should hold together and not basically distort. Now let's talk about the general properties of waxes. Very important thing is that it has a melting range because it contains several constituents, and each constituent, which may be animal or synthetic derived, has its own molecular weight and its own melting point. Hence, they have a melting range rather than a melting point. So, what is the clinical significance of this melting range? This is beneficial because it makes it easy to manipulate the wax and shape them before they completely melt at a specific point. So, instead of a specific melting point, they have a vast range, and that that range we can use to do our carving or manipulation. Now, if you can recall, when we were studying the coefficient of thermal expansion, it was mentioned that the waxes have the highest value of coefficient of thermal expansion. They expand and contract with changes in temperature. So, this is very important that the coefficient of thermal expansion is very high. So, that's why they have to be handled very carefully. So, there isn't a sudden change in their dimensions when there are thermal changes. Next is the solid-solid transition temperature. Now, this is basically a phenomena which is seen when wax are heated. They naturally have an orthorhombic crystal lattice structure, and on heating them to the solid-solid transition temperature, they undergo a change from this orthorhombic crystal lattice form to a hexagonal form. So, this change is taking place, and this temperature at which this change is taking place is called the softening temperature. This is the ideal temperature for the manipulation and molding of the waxes, and it is well before the melting point. So, and again, the clinical significance is that at this temperature we can carry out whatever manipulation or molding we want to carry out. Another important thermal property is that it has very poor thermal conductivity. It is an insulator, but at the same time, its conductivity is very poor. Hence, you have already seen the manipulation of wax, and you must have noticed that when we are heating wax, we have to ensure that we do uniform heating from all the sides and all the surfaces for proper softening and flow. It has very poor mechanical properties. The elastic limit, the proportional limit, and compressive strength of waxes are low compared to those with other materials, and these properties are highly dependent on the temperature. So, waxes also undergo plastic deformation over a period of time and under a load, and you all know this is called flow. Flow is seen to increase as the temperature is increased above the transition temperature, and waxes should show good flow at molding temperature to record the details, but should show little or no flow at the room temperature. So they should be stable at room temperature, but should show good flow at the molding temperature. Residual stresses. Now, this is another property. It is seen that whenever we are carving wax or subjecting it to different temperature changes, it tends to develop residual stresses or stresses within. Now, these stresses are released, so we have to be very careful. We have to ensure that we do not carry out sudden heating and cooling of the wax to prevent these stresses being incorporated and released. So waxes also have ductility, and this increases as the temperature of the wax is increased. Another unique property of waxes is that they have elastic memory. So it is seen that they have an inbuilt or natural memory, that when they are given a particular shape and they are stored at a temperature higher than which it was cooled, it returns back to that original shape. As you can see from the picture, this is a horseshoe shaped wax. So when it is placed back into this fluid, which is probably water, at a temperature higher to than which it was cooled at the temperature, it returns to its original U shape. Now let's start with the pattern waxes. The pattern waxes, which are composed of inlay, base plate wax, and casting wax. So pattern wax is used to create an outline or pattern of a metallic or polymeric dental restoration. Wherever we need patterns, we use to make any restoration or prosthesis, we use basically our pattern waxes. Inlay wax, casting wax, and base plate wax. Let's start with the inlay wax. It is a specialized dental wax that can be used for both direct or indirect techniques, and we apply to the die in case of indirect technique, or directly to the prepared tooth in case of a direct technique, to fabricate a wax pattern which may be for crown, inlays, or bridges. So and this usually comes in the form of blue or green rods. The desirable properties are that when softened, the wax should be uniform. So this can be only achieved if we carry out uniform heating. Contrasting color to the dye or prepared tooth, that is why it is usually blue or green in color. No flaking or surface roughness, should not chip or pull away, should be cohesive. And when we burn it out completely at about 500 degrees, it should leave no residue or byproduct. It should be rigid and dimensionally stable until eliminated. Now, very important is its composition, and it is also asked in your exam. So, whenever you're asked about the composition of any material, always remember that give the complete composition in detail with the percentages and the function of each and every constituent. Now, the composition of inlay wax composed of basically natural waxes and additives. In the natural waxes, we have mainly paraffin, which is 60%, sericin, which is 10%, carnauba, which is 25%, and beeswax, which is 5%, and in the additive, gum damar. Now, looking at the constituents separately, paraffin 60% determines the melting point, sericin reduces flakiness, carnauba gives it the high melting point, glossiness, good hardness, and decreased flow at mouth temperature. In place of carnauba, candelilla can be used. Gum damar, which is the additive, increases the finish and gives a smooth surface, and the beeswax is basically added to give better plasticity and flow. It is usually available in round sticks or basically rods, and usually they are blue in color. Now, the classification of inlay wax is very important. There are two types. Type 1, which is hard, is used in the direct technique or in the oral cavity. Type 2, which is soft, is used in the indirect technique in the lab. Now, let's look at the different properties of both type 1 and type 2. The flow properties in particular. Type 1, the hard inlay wax used in the direct technique shows 1% flow only at 37 degrees, but maximum 90% flow at 45 degrees. The same is the case with type 2, the soft indirect techniques, and at 45 degrees it shows 90% flow, and obviously shows no flow at 37 degrees because we are not placing it in the oral cavity. So inlay wax has the highest flow at 45 degrees. This is the molding or the softening temperature, and this is the temperature at which we heat the inlay wax and make our wax pattern. And at this temperature, accurate detail recording is possible in the prepared cavity, which may be within the mouth as the direct technique, or it may be on the die as in the indirect technique. Now, the properties of inlay wax. The thermal properties, as mentioned, like all waxes, it has a high coefficient of thermal expansion, and this can distort the pattern, especially in the direct technique compared to the indirect technique. Now, why is that? That is because when we are placing our wax pattern within the mouth in the direct technique and we are taking it out, there are sudden temperature changes from 37 degrees Celsius to the room temperature. This thermal change can lead to, because of its high coefficient of thermal expansion, this can lead to a change in the dimension. That is why indirect technique is preferred, where there is a stable temperature and no sudden temperature change. It has low thermal conductivity, difficult to heat, and it also goes solid-solid transition temperature. Uses of inlay wax, both in direct and indirect technique, and the patterns for inlays, crowns, and ridges in both techniques. Now, we don't need to go into the detail of the whole technique of direct and indirect procedure. Just remember, direct technique is done on the prepared tooth and indirect is done on the die. Moving on to the casting wax. Now, casting wax is basically a type of pattern wax, and it is used to form wax pattern of the metallic framework of removable, partial, or complete denture. The key word is the metallic framework. Wherever we have to make any kind of metallic part for removable or complete denture, we use casting wax. And compared to inlay wax, it has a higher melting temperature and it is more rigid than inlay wax. It reproduces the exact size, shape, and contour during the casting process, and it is available as pre-formed patterns that come in the shape of either clasps or bases, as you can see from the picture. Composition is totally the same as inlay wax: 60% paraffin, 25% sericin, 10% beeswax, resins, and other waxes, and the function of all these constituents is exactly the same. Comes in thin sheets and ready-made shapes. Now, what are the uses of casting wax? As I mentioned earlier, for the metallic framework of removable partial dentures, metallic denture base of complete denture, and metallic slits. Ideal requirements are the same, but they should be more rigid, high ductility, pliable, dimensionally stable, should be slightly tacky to hold to basically be held together in the gypsum cast. It should not be brittle on cooling and leave no residue. Now let's move on to base plate wax, also a type of pattern wax and very important. This derives its name from because of the fact that it is used on the base plate of dentures. Dental wax provided in sheets form. You've already seen it as well in your practical. These are basically pink sheets, and they're used to form the initial or the temporary wax rims for the construction of complete dentures. It is also known as modeling wax, and it has a lot of uses. But let's go to the composition first. Its composition is also very important. Generally, basically, the main constituent is paraffin or salicin, which is 80%, 12% beeswax, 2.5% carnauba, 3% synthetic resins, 2.5% microcrystalline, and coloring agents. Now the classification. There are basically three types of base plate wax. Type 1, which is the soft wax for building contours and veneers. Type 2, which is the hard wax for making patterns in the mouth in the temperate climates. Type 3, which is extra hard for trials in the mouth in tropical weather. And the base plate wax we are usually using over here is the type 2 wax. Now the requirements are more or less the same. Should be trimmed easily, smooth glossy surface, should not adhere to the other sheets, should not cause any irritation, should be dimensionally stable. When we are making white blocks and placing the teeth on them, it should not leave any stain or residue on the artificial teeth. Now the uses of base plate wax. Most importantly, it is used to make the base plate of the occlusal rims or white blocks for recording the vertical dimension of occlusion and jaw relation. So as you can see from the picture, there are two bite blocks of the upper and the lower. And these bite blocks will be used to set the denture or the artificial teeth, and finally they will be articulated onto the articulator, and the maxillomandibular relationship will be established, and all the parameters of occlusion will be determined. It can be used for the final wax up after trial. Now these are all denture making steps. I know they may seem a bit confusing at this stage, but right now just remember the uses, just memorize them, and you will once we proceed further, and obviously when you will be carrying out these steps in your prosto rotation, you'll get a better understanding of all the uses of these materials. To make patterns for the orthodontic appliances and may be used to form a portion of a tray. So these are basically the base plate wax blocks. As you can see, they're placed in the patient's mouth, and we determine the upper and lower relationship, and according to that we set the teeth on these wax or bite blocks. Now let's move to the processing wax. They are not used to make any sort of patterns, and just used in the fabrication of models, impressions, and during soldering. And they are composed of basically beading and boxing waxes, utility waxes, and sticky waxes. Boxing waxes. Now, as the name suggests, this is basically used to make a box-like border at the perimeter of an impression, to basically protect your impression or cast, to make a boundary and preserve the authenticity and thickness of the impression. So its function is just as a protective border around your impression. We don't need to go into the method or technique. Ideal requirements are that it should be able to stick all around the impression material, should be strong and rigid. So when you place your impression and pour it with gypsum onto the vibrator, it should be able to withstand the vibration forces. It should have a smooth glossy surface and retain its shape at room temperature. Now moving on to the utility waxes. These are basically adhesive waxes used to alter the shape of stock trays. So basically their function is basically to alter this different tray dimensions, which may be the height of the tray. It can be increased. If, for example, you have a patient who comes to you and your stock trays come in small, medium, large sizes, and those none of those sizes fit the patient. Maybe too small, maybe his or her arch may be too small or maybe too large. So what you can do is that you can use these waxes to alter your tray size. The height can be increased, the extensions can be increased, and the wall depth can also be decreased if you have a patient with a very deep palate. And this is because they are very adhesive to each other, and that is why we can use it easily to extend the tray borders. So this is the next picture actually shows how it can be used to extend the borders. Finally, coming to sticky wax, and you've also been shown this wax in your practical. It's a yellow, hard and rigid kind of stick that is used to assemble the metallic or resin pieces in position before soldering and repair. So basically, it is used wherever you have a broken or fractured denture. The first thing you will actually do is join the pieces together and heat the wax and stick them together before you send it for repair. It is composed of beeswax and naturally occurring resins. Gum damar is present, and actually it is very hard and brittle at room temperature, but when you heat it, it becomes sticky and will strongly adhere to the dental parts and will help in joining them together. Now, finally, the impression waxes, which are composed of corrective impression waxes and bite registration waxes, also called occlusal registration waxes. Corrective impression wax, as the name suggests, it is used to make a type of dental impression only used for edentulous patients. Remember that composition is paraffin, terasin, beeswax, and some metallic particles. Now, compared to the pattern waxes, in which we saw that the flow of the pattern waxes was almost less than 1% at oral temperature, 37 degrees. Compared to them, the corrective impression waxes show flow of 100% at 37 degrees. Why? Because at the oral temperature, we want them to flow properly and take the impression of the whole oral structures. So this is the main difference. However, when we remove it from the oral cavity, care must be taken to avoid any kind of distortion or dimensional change. So the use is basically to record the mucous membrane and underlying tissues in a functional state, especially, as I mentioned, in only edentulous patients or complete denture patients. So they are used to record non-undercut edentulous areas of the mouth. What are non-undercut areas? Well, these are the areas which are, the undercut areas are basically bulbosities or convexities like the tuberosity, the residual ridges, etc. These areas are very tricky when we are taking impression, because from these areas the impression material can easily get torn or distorted. So because waxes are rigid, we cannot use them in undercut areas, so only the non-undercut areas can be recorded by these corrective impression waxes. Now, moving on to the bite registration or occlusal registration waxes, they are used to record the occlusal surface of teeth, the opposing teeth, as well as an aid to establish the maxillomandibular relationship of teeth. Composition is basically beeswax or hydrocarbon waxes such as paraffin or terasin, and it may contain some parts of metallic particles. As you can see from the picture, they come in preformed U or horseshoe shaped form, and in case of edentulous patient, if we want to see the bite or check for high spots, we ask the patient to bite on them, and then we get a complete imprint of the occlusion of all the teeth on this wax. In case of edentulous patients, when we prepare rims, we ask the patient to bite on them, on the opposing arches, and that gives us a good picture of the mandibular-maxillary relationship between the two arches. So that brings us to the end of dental waxes. I hope you got a clear picture of what you're required to know. And this is a very small topic, but a very, very important topic with respect to all the aspects of your exam. So make sure that you go through it properly. And if you have any questions, feel free to contact me. Thank you.